Hi, I'm Dr. Sir Deloso and I'm one of the vets here at Deloso Veterinary Clinic. And today, di-discuss natin kung ano yung mga kailangan nating gamit when it comes to doing FHO surgery, yung tinatawag natin na Femoral Head and Neck Ostectomy. So we just did a FHO this morning and kakatapos lang linisin yung mga gamit. So I'm gonna demonstrate, show to you kung ano yung mga instrumentations needed when it comes to performing femoral head and neck ostectomy or FHO or excision arthroplasty. Okay, so we start from the right side. So my right side, should I say. Of course, we need some surgical blade. Okay, my preferred size would be number 15. And then we also need some suturing equipments. My preferred suture material is polydioxinone or PDS. We also need some spay set. So this is my spay set. I use it for spay and for suturing. Nandito kasi yung mga common na surgical instrument gaya ng needle holder, etc. So we have a specific set na ginagamit namin. So aside from that, we also need some sterilized vet wrap. It is important to be sterile kasi it is the one that I use to wrap, yung final wrap ng paa ng aso o yung pusa. Why? We need to wrap it with a sterile vet wrap because we need to manipulate the leg. We also need some 10 ml syringe. Why? Because we need to flush. So, yung ginagamit namin pang flush or lavage ng site o ng area, okay, prior to closing. And then here, yung tinatawag natin na arthroplasty rasp. Yung ginagamit natin in case na natapos na tayong nag-FHO is to smoothen or para hindi magaspang yung edges. This is a specific instrument for FHO, pero pwede rin kayong gumamit ng ganito. Ito yung tinatawag natin na bone rasp. Okay? And then we also need some periosteal elevators. Ito, yung freer elevator. So meron tayong blunt and sharp. Meron din tayong blunt and blunt. We also need some retractors kagaya nito, handheld retractor. Ang tawag dito Sen retractor. Okay, so meron tayong blunt, then meron din tayong tiger claw, yung matulis, yung sharp. So itong dalawa, lagi magkasama. We also need some Homan retractors. So we have some small Homans. Yung tsura niya. And we need some large Homans. So ito yung nilalagay ko dun sa likod ng greater trochanter para mas maging accurate yung cutting ko ng femoral head and neck. Okay? So when it comes to cutting, ibig sabihin, when we will be chopping the head of the femur, we need some osteotomes. So ito yung mga different sizes ng osteotomes ko. I do no longer use osteotomes now. Why? Because of course, you need osteotome, different sizes of osteotome that will fit the type, the neck. Okay, kasi so kailangan may large, may small, and then you also need this one, the mallet, pamukpok. Okay, so you do it to chop the head of the femur, and it should always be sharp. Okay, so I no longer use this instruments because I already have yung drill na mayroon siyang tinatawag na oscillating saw attachment. So ito yun, you have the oscillating saw attachment. So attach it to my orthopedic saw. And then meron tayong iba't ibang klase ng blade. So ito, they are already preparing it for sterilization. So ito, maraming type ng saw. It will depend on the size of the animal. Okay, so next we have some another retractors. Ito yung mga self-retaining retractor. So kung meron tayong mga handheld, ibig sabihin ng handheld, hahawakan siya ng assistant para ma-retract yung tissue. Ito self-retaining sila. So I have the family of 3, yung small, medium, large. Then meron din tayong mga baby gelpies, yung mga maliliit talaga. Okay, for smaller breeds of dogs or smaller patients. So lahat ito in autoclave. prior to surgery. And then we also have this, the pointed reduction forceps. So anong ginagamit ng reduction forceps sa FHO? Because we are cutting a bone, so siya lang yung ginagamit kong pangkuha ng cut part ng o yung naputol na part ng femoral head and neck to grasp it. And sometimes may mga buto tayong hindi maabot, so we make use of the ronger. Yung ronger, ginagamit namin sila to remove some of the sharp edges, especially if you use osteotomy. Okay, yung ganito. So I rarely use it, especially if I use the oscillating saw. So we also need this one. Magtataka kayo paano to. This is my light handle. So ito sterile siya. So every time I place it doon sa handle ng surgical light, so I could handle or angle the light. So pwede ko siyang palipat-lipat ng view para mas makita ko yung surgical area. Okay. We also have this one. This is a autoclavable cautery. Okay, cautery pencil tawag. So it has a cut and coagulate. So ito, pinapasa ko dun sa assistant ko and he attaches it. And so part of it will remain in the sterile field. So sterile siya. Okay, so bawal hawakan yung part na outside doon sa sterile area. So next, we also have yung tinatawag natin na suction tip. Particularly ito, this is known as the Fraser tip. So marami akong ganito, different sizes din. So I use it to suction some of the blood or the fluids, yung joint fluid kapag hiniwa ko na yung joint capsule. So I use this one to clear para mas malinaw yung surgical area. Okay? Or kapag may bleeding, ginagamit ko yun. Of course, you cannot use this without this. This is a autoclavable suction tubing. Okay, so once na nandun na to sa surgical, papasa mo yung other end niya para ikabit dun sa suction machine. May tubig pa pala. Ayan. Of course, you need this one. You need a bowl. Itong mga bowl natin, nirarap ito ng yung tinatawag natin na sterile wrap. Okay, nirarap siya in autoclave. So, pinapasa rin siya sa akin. Pinaglalagyan lang ito ng tubig. Then, we suction the water. Then, we flush it. And then, of course, we need some additional draping. So, laging may additional drape akong kasama. Okay, just to widen the sterile area. Okay, so these are the instruments that I use when I do femoral head and neck ostectomy. Okay, so I hope this video helped, okay, to enlighten some of my colleagues or some of the students studying veterinary medicine. So once again, I'm Dr. Serdi and I'm one of the vets here at Deloso Veterinary Clinic. Thank you.